is a readout from the webpage Xanthelasma palpebrarum, a webpage on our xanthelasmaremoval.com website. So it's a readout, and I'll give you some commentary. Xanthelasma palpebrarum is a skin condition that develops fat yellow growths on the eyelids. Xanthelasma is normally seen in people with high cholesterol or other fat lipid levels in the blood. My side note right now is that not necessarily, if you have xanthelasma, you don't necessarily have high cholesterol. Many people with normal cholesterol levels have xanthelasma. And the lesions contain high fat, lipid rich deposits. Xanthelasma palpebrarum are yellowish plaques that occur most commonly near the eyelids, more frequently on the upper eyelid than the lower eyelid. Xanthelasma palpebrarum is the most common cutaneous xanthoma. There are so many treatments available to get rid of your xanthelasma, such as simple surgical excision. It's not that simple. You'll actually see some videos on our website. Cryotherapy, which is not advisable. Chemical peeling, which is very good. You can actually use TCA on your own, even without using us. With trichloroacetic acid, radiofrequency devices, and lasers. Who gets Xanthelasma palpebrarum? Xanthelasma can occur in any age of people and sex and gender. However, females seem to be more frequently affected than males. The reason for it, very likely, is that females are more likely to seek attention, to seek a solution to that problem than men, because men are not as self-conscious as women. In addition, it is unusual for a child or teenager to develop xanthelasma. It mostly develops in middle age, between the age of 40 or 60, between the 40 and 6th decade. Approximately 1/2 of patients with xanthelasma have high amounts of fat lipids in their blood, such as high cholesterol or high triglycerides. What are the causes of Xanthelasma palpebrarum? About half the people with xanthelasma have high cholesterol. You are more likely to get these growths if you have high LDL, bad cholesterol, and low HDL, the good cholesterol. Inherited high cholesterol, and your doctor might call this familial hypercholesterolemia. The liver disease called primary biliary cirrhosis, which can raise cholesterol levels. It's most common amongst Asians and Caucasian Mediterraneans like myself. What are the signs and symptoms of Xanthelasma palpebrarum? Yellow plaques around your eyes. Presence of small, well-defined, flat skin lesions in the form of papules and plaques, which are yellowish. Several lesions may form around the eyes, on the upper and lower eyelids. Generally, the upper eyelids are affected more than the lower eyelids. The lesions may have yellowish discoloration or yellowish color. They are usually painless. Some are tender to touch. When these increase in size, they are denoted as xanthoma. Basically they're denoted as xanthoma if they grow elsewhere in the body. Some may grow large over many months to form tumors. This is case of xanthoma. When we say tumors are not, because actually xanthelasma is a type of tumor in a certain sense. In some individuals, the lesions are observed to form symmetrically around the eyes. They normally form symmetrically. It's not the case all the time. What are the risk factors? Anybody can develop xanthelasma, but you are more at risk if you're a woman, mainly because if you're a woman you seek to find a solution to that. You are between the ages of 30 and 50 and 60. You are Asian or Mediterranean descent. You are a smoker. You are obese. You have high blood pressure. You have diabetes. Your lipid levels, the fat in your blood, including cholesterol, are abnormally high. Is it harmful? Xanthelasma is not harmful or painful, but they indicate that you have dangerously high cholesterol levels and will be at risk of heart disease. This is not completely true. As I say, it is possible that you may have high cholesterol and you may be at risk of heart disease due to plaques in your blood. But that's not a given, because many people who have xanthelasma have very normal cholesterol levels. In medical terms, high cholesterol level causes xanthoma. However, it may also be found in patients with traditional or low cholesterol levels. The point is, whether you have, it's not a given if you have high cholesterol that you're going to develop xanthelasma. You may have high cholesterol and never have xanthelasma. Xanthelasma is mainly due to a familial condition. That is to say, if in your family somebody has had xanthelasma, you're somewhat likely to develop them as well. What causes, and also the other point is that in some people who have had xanthelasma and high cholesterol level, decreasing their cholesterol levels have helped them have their xanthelasma to shrink in size. What causes xanthelasma is the most frequent queries raised by sufferers of such condition. There is a small and dangerous cholesterol. There is smart and dangerous cholesterol. While smart cholesterol refers to as alpha lipoprotein, high density lipoprotein, dangerous cholesterol refers to is low density lipoprotein. Low density lipoprotein. Low density lipoprotein triggers xanthoma. Disease and hypercholesterolemia are popularly called transmitted high cholesterol, which is the opposite cause of xanthoma. This is the end of the article, and should you have any question, please get in touch with us. We've got more information on xanthelasmaremote.com, and you'll find our many videos on our YouTube channels. Thank you for watching.